So for this video, we're going to be talking about muscle performance tests that we can use when we're assessing the pelvis and the SIJ. Now, certainly there are other muscle performance tests that enter the equation when we're talking about this area of the body, say for example, the lumbar spine and even the hip. And some of these tests can be kind of extrapolated. You can use your clinical reasoning to ask yourself what impact these may have on those adjacent areas. However, for today, we're going to be looking at 3 specific tests in and around the pelvis and SIJ. And so let's go ahead and get started. The very first test is a simple bridging exercise. And so we're going to ask our patient to bring their feet up, and the knees are going to flex to approximately 90 degrees. Now in this position, we're going to ask our individual if they're familiar with the bridge. If they are, fantastic. But what we want to have them do is, without a whole lot of cueing, lift their seat or lift their bottom off the table. And the reason why we don't want to cue them very much is we want to see kind of what their innate strategy is in order to accomplish this task. And so we might say something to the effect of, what I'm going to ask you to do is lift your seat up off of the table as high as you can and hold it there and wait for further instructions. All right, so at this point we see this individual is able to complete the bridge. For an individual that's dealing with SI pain, they may have some hesitancy, or there may be a little bit of a lack of smoothness as they come up. But things that you can begin to look for, whether or not the knees are about shoulder width apart, if one side is more kind of collapsed or rotated than another, if there's evenness there, how much they're utilizing their arms to kind of push into the table to accomplish this task. Even their face can tell you whether or not they're grimacing or if this is a pretty challenging task. And once they're up, you can again look for just some of that aspect of symmetry. Go ahead and relax now. Now the second test here is a theme on this bridge. And so what we're going to look at now is a bridge plus a straight leg raise. And essentially what that looks like is it's going to be knee extension on either limb, which is going to force them into essentially a single point of contact while performing that bridge. Now what that does is it requires them to have to recruit their stabilization, dynamic stabilizers, a little bit differently. So let's go ahead and come into that. Go ahead and bridge back up into that position. Now what I want you to do is I want you to straighten this knee out, right? You can see in this case our patient is able to do that, right? Things that we're looking for: is there a degree of rotation here at the pelvis? Are they able to maintain hip extension on their stance side? Are they recruiting up into a little bit more hip flexion? Are they able to maintain a full knee extended position? How much are they recruiting the arms? What does their face tell us, right? Go ahead and relax down on this side. Okay, so when you're ready, we're going to come back up into that bridge position, and now we're going to extend out the other side. And you want to complete this on both sides, again looking for symmetry, looking to see if there is any differences, as well as asking your patient if there's any differences in terms of pain or kind of their comparable sign. Good, and relax now. Now, while not technically part of the muscle performance side of things, there are a few additional things that you may choose to add into both the bridge and the bridge straight leg raise. And so I want to show you just a few of those modifications that can also then be used as a graded exposure plan in terms of interventions. So we're going to ask our individual to bridge up one more time. And now what we're going to ask is that they perform a little bit of a march. So you're going to lift this knee up to my hand right here. Good. And then go back down. Now to this side and back down. Keep it nice and slow and controlled. Good. One more time on each side. Good. And relax. So by incorporating that little bit of a march, we also start to see kind of one of the roles of the pelvis, which is to help and assist in locomotion and gait. And in this position, we can begin to see, can they disassociate right versus left? Can they handle that reciprocity of movement? And again, this can be a nice progression into their interventions. When it comes to the bridge plus straight leg raise, we're going to ask our individual to bridge up again. We're going to ask them to straighten this knee out for us. And now we can start to play with a few things. Bring your toes back as far as you can, so we can include a little bit of dorsiflexion. We can ask them to move through hip abduction as well as hip adduction, coming back in, and seeing how that challenges their base of support and ability to balance, we can also have them come up into more flexion and come down into more extension. So challenging multiple planes here. Go ahead and relax. And so really all of these pieces that we're looking at from an assessment standpoint can also become interventional. Now the third and final test that we want to look at in terms of muscle performance is the ability to maintain a neutral pelvis in a side-lying position. And neutral is really their comfortable position. It's not a defined specific point, but just where they would naturally move if they were looking for that position of comfort. So we're going to ask our patient to roll onto their side. At this point, I typically will give them a pillow for support. And what we're looking for here is for alignment all the way through from essentially the lateral malleolus through the greater trochanter, the acromion, and the ear. We want a nice straight line. If you see your patient kind of flexed here in the hip, or they're trying to kind of bend the knees back for a little bit more support, just help with that alignment, okay? At this point then, we want to ensure that the hips are stacked. We're not going to stabilize at all because we want our patient to do the dynamic stabilization for us, but rather we're going to provide just a little bit of a cue with a gentle handhold here to make sure that they're not rolling back or rolling forward in the initial setup. From here, we're going to ask them to come into hip abduction up to our hand. Perfect, so kind of a mid-range point. Now we're going to take our hand away because we don't want to provide any cueing. We want to see what the strategy is, and we're going to push. And yes, we want this long lever arm. So hold strong, hold, 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 hold. Good. Now, some things that you might see, when you go to push, the individual might come into hip flexion, right? When you go to push, that individual might roll their hips back a little bit, or they might roll forward a little bit. You'll see all kinds of compensatory strategies with this, and recognize you can always add more pressure, but it's tough to take that away once you've kind of exceeded their capacity. So less is more as you get started. So again, 3 tests, muscle performance based in and around the SIJ, a simple bridge, adding in a straight leg raise as well as some of the variations, and then finally our active hip abduction with an emphasis on a neutral pelvis. Have a go with these individual tests and measures, and let me know if there's any questions.